And I call the member for Higgins.
Thank you, Deputy Speaker. I move the motion relating to the Pharmaceutical Benefit Scheme in the terms in which it appears on the notice paper. Deputy Speaker, cheaper medicines have been a win for patients. They've been a win for their hip pockets, their health, and for the wider health system. When meds are cheaper, people are more likely to fill out their scripts. They're more likely to take their medication. In other words, compliance improves dramatically, and there's evidence to back that up. And when they take their meds and compliance improves, it's a virtuous cycle that spins up. Avoidable presentations to the emergency department do not occur. And I've seen this time and time again, numerous patients who were admitted to hospital because they simply had run out of money to take their medications. In 2020 to 2021, just to give you an idea of the scale of this issue, 314 million prescriptions were provided to 17 million Australians. We know now that almost 1 million Australians take 5 or more meds a year. Now, that's polypharmacy. It's not necessarily a good thing, but it is the reality we live in. So for many Australians, taking their medication is a really significant hit to their hip pocket, which is why we have, since the day we took office, focused on making medicines cheaper for Australians, and in doing so, improving compliance and reducing the number of presentations to the emergency department. In July of the year we formed government, in 2022, we lowered the PBS safety net threshold. In October that year, we reduced the price of 2,000 brands of medicines. In January of last year, we delivered the largest price reduction in the 75-year history of the PBS. The PBS, or the Pharmaceutical Benefit Scheme, is Australia's national formulary, a list or a directory of all the medications we have to provide to the Australian people, all of which have been robustly and rigorously tested and come in at a price point that is not going to bankrupt the country. This PBS is actually a legacy of the Chifley government. He had to actually take it to a referendum in order to get it done. But the PBS now is a gift to our nation, and what it does is that it has allowed more and more Australians to receive cheaper meds. Now, when the Liberals left office, meds were, after 10 years I might add, a general script was $42.50. They could have, in that interval, actually reduced the price of medications for Australians. Instead, they didn't. We came in and we brought that down by $12.50. So now a general script is no more than $31.60 for medicines on the PBS. But if you're a pensioner or a concession card holder, you'll be paying no more than $7.70. We froze those prices in the last budget, in the May budget, such that for general patients, that price of $31.60 per script will last till the end of next year, and for concession patients, it'll go on for another 5 years, so frozen those costs. But not only that, we also introduced, after some resistance from the pharmacy sector, 60-day scripts. And 60-day scripts are really important for patients, those 1 million Australians who are taking 5 or more medications. In other words, patients with chronic diseases who are going to be taking these drugs for a lifetime. And we introduced this September last year for 100 medications. A second tranche came in March of this year for another 100 meds. September this year, it'll be another 300 medications. And I just want to go through what that actually means for some patients. Now, on the topic of diseases, we often think of diabetes, hypertension, hyperlipidemia, but in fact there are a host of rare diseases. There are around 7,000 rare diseases that collectively affect 2 million Australians, both adults and children. And one of those diseases is amyloidosis. Amyloidosis is a very rare disease. It affects less than 2,000 Australians per year. And I have, in my 26-year career, when I was practicing, I've only ever diagnosed it once in a patient who presented late, and that is the norm. We have made Onpattro, a medication for a hereditary type of amyloidosis, now available to Australian patients. And this is a game-changer drug. It can actually slow the disease down, preventing the development of further neuropathy or cardiomyopathy, which can then lead to heart failure. It has improved the lives of Australians. It is a rare disease. It affects about 55 patients per year, but those patients would otherwise be paying close to $650,000 per year for this drug. They will now be getting it for $31.60 per script. Infusions, which they take every 3 weeks, an absolute lifesaver. That is what cheaper meds means for the Australian people.